Today we will discuss about the monoclonal antibodies in hematology and oncological malignancies. And with advancement, the monoclonal antibodies has become the integral part of management of various tumors, and it is found that it improves the overall survival and progression-free survival in majority of cases. So we start with the monoclonal antibodies. These are the protein produced by B lymphocytes of immune system in response to foreign proteins. These are called antigens, and glycoproteins also called as immunoglobulins. Polyclonal antibodies are obtained from different B cell resources, and combination of immunoglobulins molecules secreted against a specific antigen, and each identifying a different epitope. So what is monoclonal antibody? Monoclonal antibodies are made by identical immune cells that are clone of single unique parent cell. So they are called monoclonal. And monospecific antibodies have affinity for the same epitope of antigen, and they are considered a form of passive immunotherapy. So this is the historical part. In 1975, Caesar and Milstein and George Kohler, they devised a laboratory technique for making monoclonal antibodies. They wanted to have long-lived cell line that would make antibodies of a single kind, and fuse the mouse spleen cells with the mouse myeloma cells to make hybridoma cells. And for their work, they were awarded with the Nobel Prize in 1984. So how the monoclonal antibodies are prepared? They are prepared by hybridoma technique, in which a mouse is immunized and the spleen cells are isolated. These cells are fused with the spleen cells with myeloma cells, and they allow to unfuse B cells to die. Then HAT culture is added to kill the unfused myeloma cells. The screen supernatant of each clone for presence of the desired antibody is separated. But what is the problem in using the mouse monoclonal antibodies? Because these were the first monoclonal antibodies made entirely from mouse cells, but the main difficulty in using is that they are antigenic. Our immune system becomes reactive and try to destroy these cells. So after mouse monoclonal antibody, there was evolution of monoclonal antibodies over the time. Researchers have learned how to replace some parts of these mouse antibody protein with human parts, and depending on how much of the MAB is human, these are called chimeric or humanized antibodies. This is the molecular structure of monoclonal antibody. In chimeric monoclonal antibodies, these are obtained by genetically fusing the mouse variable domains to human constant domains, and variable regions are isolated using polymerase chain reaction, and affinity and specificity is unchanged. So the problem with chimeric monoclonal antibody is that anti-chimeric antibody, they have usually cross reaction with immune system. So after that, humanized monoclonal antibodies were generated, and these are specific and the cross reaction are less. Human antibodies directly from human, and they technically much more difficult to immortalize and clone the human B cells and human hybridomas. It raises ethical problems also. So these are the different structures of monoclonal antibodies. So how the nomenclature of these monoclonal antibodies are done? The stem is made of MAB. MAB means monoclonal antibody, and the substem for indicates the origin or source of the monoclonal antibody, as it denotes animal origin. O means mouse, U means human, XI means it is chimeric, and ZU means it is humanized. XIZU, if it comes in the last, then the partially chimeric and antibody is partially humanized. So this is the sub-stem for nomenclature. CI means circulatory system, example is abciximab. LI means immune system. TU means tumor. VI means virus, and KIN means interleukin. OS stands for bone. These are used for bone tumors, and example is denosumab. So what is the application of monoclonal antibodies? They are used extensively in biomedical research, in diagnosis of disease and infection, in treatment of various diseases and treatment of cancer, in serological assay. They are used as a marker in identification of protein, carbohydrate, nucleic acid. So now we will discuss the role of monoclonal antibodies in cancer. So there are two types of monoclonal antibodies used in cancer treatment. One is naked monoclonal antibodies and second is conjugated monoclonal antibodies. Naked means they are those without any drug or radioactive material, and conjugated means they have a cytotoxic agent combined with the monoclonal antibody. What is the mode of action? The marker for destruction attaches to cancer cells and acts as a marker for the body's immune system to destroy them. The example are rituximab, ofatumumab and alemtuzumab. So trastuzumab is a monoclonal antibody against HER2 receptors that is present in breast cancer and some cases of lung cancers also. So the HER2 is a surface receptors. These monoclonal antibodies bind to these receptors and have a very efficacious effect in patients of breast cancer. Other are cetuximab, panitumumab, bevacizumab. So cetuximab is a monoclonal antibody against EGFR protein, and this is used in patients of head and neck cancer or in patients of colon cancer. Panitumumab, again EGFR monoclonal antibody, this is used for treatment of colon cancer. Bevacizumab, this is a VEGF monoclonal antibody against VEGF, and this is used in treatment of ovarian cancer and metastatic colon cancer. We have different conjugates that bind to the monoclonal antibodies and destroy the cancer cells, and the example of these are also known as immunotoxins. And the cells, the monoclonal antibodies are known as radio-labeled antibodies. Two important radio-labeled antibodies that have been approved for treatment of cancer are ibrutinib and tositumumab. Ibrutinib is used in B-cell NHL and tositumumab is used in non-Hodgkin's lymphoma. Chemo-labeled antibodies are useful and they have been approved for treatment of cancer. Gemtuzumab ozogamycin is a monoclonal antibody against CD33 antigen present on the cancer cells in AML, and this is approved for use in acute myeloid leukemia. These are other monoclonal antibodies, immunotoxins BL22 and immunotoxin HA22. So this diagram shows the different monoclonal antibodies used in hematological malignancies, and these are the monoclonal antibodies that are used in solid tumors. This table shows the name of antibody and that is its type and the target of the monoclonal antibody, and these are the different indication where these monoclonal antibodies are commonly used. We can see alemtuzumab used in CLL patient, bevacizumab used in colorectal cancer and ovarian cancer, cetuximab used in head and neck cancers, denosumab, this is used for osteoporosis and for bony metastasis, ibrutinib for NHL patients, panitumumab for colorectal cancer, and we have a lot of monoclonal antibodies that need to be approved in future, and with the list we will have more monoclonal antibodies in our armamentarium for treatment of cancer patients. Thank you.